Okay, ma'am. Okay, good morning, everyone. I'm Dhanya Jose. I heartily welcome you all to the one-day international webinar on COVID-19 mental health challenges and implications, organized by the PG Department of Physics and Research Center in association with the Internal Quality Assurance Cell of St. Xavier's College for Women, Aluva. Kindly cooperate with us and follow the guidelines for the proper conduction of the webinar. During the session, please keep your audio muted and videos restored. Don't present your screen during the webinar session to avoid unnecessary disturbances. Kindly write your name and address in the chat box after the recording gets started. This would be an hour-long talk followed by an interactive session. Participants can post their queries in the chat box, which will be discussed at the end of the presentation. Interaction with the speaker during the presentation will not be entertained. Towards the end of the webinar, the feedback form will be shared in the chat box and the WhatsApp group, which should be filled by the participant to get the e-certificate. Now, I invite Dr. Xavier, IQAC Coordinator and Head of the Department of Physics, St. Xavier's College for Women, Aluva, for the welcome speech.
Thank you, Dhanya. Good morning to all. Respected Principal, Dr. Sister Xavier, esteemed resource person, Dr. Henry Poritos, and dear participants. During the last 5 months, it was an unexpected experience for all of us to stay indoors. As we proceeded through this confinement, various attributes related to our social existence has put us in very difficult situations. Every age group, the young generation, the middle age, and the old generation, started expressing deviation from their normal course of mental expressions. This has mounted to very large extent in young generation, and the resulting consequences are quite alarming. The Internal Quality Assurance Cell and the Department of Physics of St. Xavier's College decided to open up discussions on this unprecedented challenges, its consequences, and to design corrective measures. I take this opportunity to congratulate Ms. Dhanya Jose for taking initiative to organize this webinar and Dr. Sujatha for coordinating it. And at the same time, I appreciate all the members of the Department of Physics for the successful conduct of this webinar during this challenging period of COVID-19. Dr. Sister Xavier, our beloved principal, is the source of inspiration, support, and guiding light for all the quality initiatives taken up by the IQAC and the Department of Physics. On behalf of all the participants, I extend a warm welcome to you, sister.
Thank you, Tina.
Today, we are really fortunate and honored to have with us Dr. Henry Poritos as our resource person for this webinar. Dr. Poritos joined the College of Education and Social Sciences, West Texas A&M University in 2012. He received a BA in Economics from St. Albert's College in 1996 and MA in Economics from SH College Tevara and MSW in 2002. He received his PhD in social work from the University of Utah. His research interest includes family relationships, delinquency and violence, social policy, multiculturalism, and poverty. On behalf of St. Xavier's College and all the participants, I welcome you, sir, to this webinar. I extend a most cordial welcome. To all the participants of this webinar. Thank you all. Dhanya, over to you. Dhanya, are you there? There may be connection problem for Dhanya. Now I welcome our principal, Dr. Sister Xavier, for the presidential address.
Good morning to all. Chief guest of the day, Dr. Henry Poritos, Dr. Xavier, IQAC coordinator and HOD of the PG and Research Department of Physics, and dear participants. Today's international webinar on COVID-19, mental health challenges and implications is jointly organized by IQAC of St. Xavier's College for Women, Aluva, and the Department of Physics. Let me first congratulate the organizers and all those who are attending this webinar. As we welcome our resource person, Dr. Henry Poritos, I also express our gratitude for accepting our invitation to attend this webinar on a topic of extreme importance. It was a sudden turn of events when lockdown disturbed the entire academic system. As we proceeded through this containment knowingly or unknowingly, especially the young generation finds it difficult to proceed their normal course of action. Right from the undergraduate to the postgraduate segments, concerns and difficulties mounted day by day, leading to a very high stressful condition. Perhaps most of you may be aware of the consequences that are resulting from this stress condition. As we are facing this for the first time and there's a sudden change, it would be a great occasion for us to listen from experts in diverse fields. I'm sure our today's resource person will take us into the prevailing problems and the measures we have to adopt to overcome this pandemic crisis. Let us all pray together to God Almighty to guard us and to save our land from this COVID-19. Wish you all the best. Thank you.
Thank you, sister. Thank you for your valuable words. Without any delay, let us start our session. I will now switch over the platform to Dr. Henry Poritos. Let us begin the session, sir.
Thank you very much. Dear respected principal, Reverend Sister Principal, dear Dr. Xavier, the head of the department, and all the faculty in the college and all the participants of this presentation. It's a privilege to be here with you all. And you can all hear me, right? Yeah, I can't see you. This is one of the limitations.
Yes, sir, we can hear you.
That's what I want to hear. That's great. So it's a privilege and honor to be presenting on this topic of COVID-19 on mental health. This is one of the challenging times in our. Let's say my mother is more than 80 years old. She said to me, this is the first time ever in her life she's seeing such a thing. She can't go out. She can't do anything. She's with me here. She came for a visit. She's trapped. That is the life we are experiencing. Everything has changed. So it is quite interesting how this is evolving. The knowledge we know is limited. Everything is changing. So this is an interesting topic to be discussed with. And I always, even though I know you are being told not to ask questions, not to interrupt me, that's the objective of it. But I encourage you to ask questions if you feel like. The moment you feel like ask questions, you should. The questions lead to answers. That's my basic belief. I believe that until and unless we have questions, there are no answers. See, if you look up, you may have a fan over you. That fan is an answer to a question, right? Then came another question. No, this fan is not enough. So they thought about an air conditioner. So a question leads to answer. So if you feel like asking question, jump for it. So I will try. I don't know. I can't find any comments here, but it pops up. If it pops up, I will find it. I will answer. If I can't answer right at that moment, I will answer at the later part of the session. So let me give you, as always, even when I teach my students here, I say that my session will be this long. That's my way of dealing with it. So my session will be 45 to 50 minutes long, and 10 to 15 minutes will be kept for asking questions. So it is I will be sticking on to that. Now it is 11:09. So sorry, it is. Yeah, I'm so sorry. It is. Yeah, almost 9:40 at your time. So I will be sticking on with the time limit on that one too. So let me begin the session on that one. Did I miss anything? Yeah, I need to just I was being introduced by uh, Dr. Xavier. I'm so happy for that. And briefly, I'm from Ernakulam. My native place is called Vadudala. I'm so happy to be from that place, and I'm a proud uh, person to say that I'm from that place. It's near to the Lourdes Hospital in Ernakulam, so that's my native place. I moved to United States in 2008. Before that, I was teaching in a college in Pirume, Kuttikanam. It's called Marian College. I was teaching there for 5 years, and then I came here for do my PhD in the University of Utah. Then I moved to this position here. I'm an associate professor and the director of the graduate program. That's a brief. And I have, yeah, about my family. I told about my mother. My father died 5 years back. My mother is with us today. And I have my wife, then two girls. They are 10 and 8 years old. That's my small family. And all my other family members are in India, in Kerala. That's briefly about me. And jumping into the COVID-19 and the mental health challenges and implications, like I said in the beginning, this is an unprecedented time which we never, ever thought about. We have seen in the movies. I have seen the Hollywood movies which talks about the pandemic and epidemic, those kind of things. But this is something unique. If you look at the slide which you're seeing, which I am projecting, you can see the COVID, that the virus. Imagine the people are wearing masks. That is something we are unheard of. That is not normal to us. The people are being treated like we see in the movies with a full protective gears. They are cleaning the cities, the places, and the research is happening, which you can see there too. Everything has changed. The world has changed the way we know it. That is the interesting thing, and that is the one of the challenging things we come across. When we look into COVID-19, the scientists, like the social science, the researchers, see it from a different perspective. We see it as a traumatic event. Okay, a traumatic event. So from that, we go to the next slide. This is called as a traumatic event. A traumatic event means, you see, there are a lot of traumatic events that happens to in our life. When we lose a person so close to us, our kin or the loved one, the one we love most, when we lose that person, that's a traumatic event individually. Let's say 2 years back in Kerala, we had the flood, devastating experience. That is a traumatic event. Again, in 19, we had the mudslide, which is happening today too. In the last 2 days, today I was reading in the news that a person died due to the mudslides in near to Munnar. So Nalladani, that's a place called Nalladani. There is a mudslide and another person died. So these kind of traumatic events are drastically affecting us physically, emotionally, psychologically. And it's also creating an experience of threat. That is an important thing. Threat of what? Our own safety and the stability of the world we live in. Our world we live in. See, when we say our world, the one's world is not the world of the entire globe. No. Our world is our family, your friends, your neighbors, or the circle like that. The first circle is so close. The second circle is a little bit much more wider, and then the much wider circle. So in this way, we live. This is challenging that. The COVID-19 has challenged the existence of our safety. That is what is happening. So think about, if you look at around the world, every day we are hearing, oh, this person died, this person died. So even I will, think about this. These stories are affecting us mentally in one way or other. On top of that, if you turn on the news, there is hundreds of other stories, which is devastating stories most of the time. This is what is happening. So this traumatic event is, in a way, affecting your mental health. So if we move on, what happens when there is a traumatic event? That's the first question you should ask. What is happening when there is a traumatic event? You can think about, like I said, losing one's loved one. And so that's a interesting way to think about. Maybe if it's a little bit more traumatic when you think about your personal life. Think about your friend or someone who lost their next to kin or someone they love. So in that event, think about the experiences they went through, the denial, the sadness, the level they can't believe it's happening. Everything it is happening to the individual. Now when we move to a global level, where everyone except in Antarctic and Arctic region, when there are no people living there, it has affected the globe. This pandemic has affected completely the entire world. So this is how it is going to affect us. What happens when there is a traumatic event? So let's see. Here you have to think. There are a lot of I have kept few things you can add on to this. Most of these are based on the research. I kept every information you hear in this presentation is from the research which is happened recently in 2020. I kept all the references at the second last slides. I think I have only 20 slides for this presentation, so 18 and 19 are my references. So you can find it if you want. I can send my PowerPoint later. All the information I collected is from the recent researchers with COVID-19 and how it affected the mental health of the people in the world. So think about this extreme sense of powerlessness. That is one of the major things that is happening to us. We believe ourselves as an epitome of heroism. Our world is centered around us. We are thinking like the heroes of a movie, right? A teenager who is imagining that. I always think like that when I was a young teenager. I usually thought about that time the cricket was so super, so popular among us. So the last over, the last ball, we need 6 more runs to win. I dream like I am the batsman who is striking the ball to the boundary line, the sixer. Because see, that's my imagination. So I'm the hero of everything we believe. So we have the extreme sense of powerfulness. From there, the powerlessness came into existence. We don't have control over the COVID. We can't do anything on this. Nowadays I get the information from WhatsApp saying that you need to drink that, you need to drink this, be healthy, do that, do this. Why we do that? Because of the sense of powerlessness. I don't have control. What I have control, I will do this. That's my power. So people are doing that. I'm not against anything like that. It's people's belief, and people can have all the right to believe those things. So it is because of the powerlessness. From powerlessness, you have to move on to the second topic, disruption of beliefs and expectations. This is an important thing. Beliefs is different type of beliefs. You can't believe in a political dogma or a religious ideology or anything you can believe in. You can believe in the superpower that is in existence. But still, when you pray to, when you go to a temple or go to a church or to a mosque, your belief is disrupted, your expectation is disrupted. You are praying, nothing is happening. The world is still going on. So there is that powerlessness. We divert to a supreme power. Again, it is disrupted. So that brings to the third point, the vulnerability. That's a sense of vulnerability. I'm prone to many things. I'm exposed. I can get this virus. So this kind of transition and comes to the cohabitation. We have this group of friends and everything. Can I trust this person? Does this person have COVID-19? That trust issue. You might have seen these trust issues when the so-called NRIs return back to our country, our land. A lot of neighbors said that no, that person is COVID. He's stepping out of the home and don't do that. Everyone was, in a way or other, impacted by it. They can't trust their friends or neighbors. So the trust aspect is challenged. That leads to the next question: why they came from the NRIs came back? The economic impact. Lots of people lost their jobs. Economic impact is huge. It is one of the core problems of any problems. No, it's a core, the base problem. When we don't know, the number of crime rate always goes up when the economic impact is there. The job is gone, the crime rate goes up. In all across the world, it happens. That it is that root cause for many other things. Then comes the work and school closures. Most of you are college students, and this is an unprecedented time. You are trying to learn through online platforms. This is most of the things you are not used to, how to navigate all these kind of things, and also you need to have an internet for that, and it should be of a good bandwidth so that you can access all the materials easily as possible, but which is not happening all the time. So I heard a story of a kid in Kerala got a TV just because, and heard another story of a girl who committed suicide because she didn't have a TV. So this is something that's happening. So everything is challenged. Then comes the inadequate resources for medical response. That is a big topic which has to be discussed. In Kerala, we have less than 400 ventilators. And that is a major challenge we have. So I didn't read any new reports of increasing that number of ventilators in the state of Kerala. But so we have resources. Is an adequate resource? We have 3.3 crores of people in the state of Kerala. If it's a mass infection, then the world is different. So then comes the deficient distribution of necessities. That deficiency is an interesting thing to think about. Initially, the response from the government was to distribute the food and necessary materials to people to access food and the resources. It was there. To what extent it can go? What happened in Trivandrum when people lost their jobs? They had to come out. They don't have any other economic resources. So all these things are happening when this traumatic event happens, like COVID-19. From there, we need to come into the challenges very specific to ours, and which I added some specific local and then the global scenarios. We need to adapt to a new normal. That is the bottom line. We need to adapt to a new normal. This is not a normal thing for us. This is something new. That's why when you look into people, it's really hard for them to adapt. I was watching the TV news on the engineering entrance exam, and I could see the crowds of people clustered together on the gate of these entrance centers. Imagine people so close. How can it spread the virus? Even if you wear a mask or not, that 6 feet is something we need to adhere to. And culturally, our proximity is so close. Our personal circle, that aura, is so close. Um, let's say if you step into a public transport system, any bus or anything, you can see people are jam-packed. They're together. They're not away from each other. That is our culture. We are used to that. Change that culture, it's not that easy. It's that hard. So we are constantly reminded to change the way we are living because of this. And that change is the hardest thing. That is the hardest part of life. And we have already entered to a territory which we don't know. That is online learning. This online learning is something uniquely different for us. When I call my family and my friends there, they say that, oh, they get these study materials in the evening through WhatsApp or some email. So they have to go through it at night, and they may do it some in the morning. So this is something new for us. And this is challenging the students, the faculty, and the administration. Administration, it's also a new game for them. They are in a new platform. It's not a day-to-day thing for them. They are learning eventually. Here, we have a lot of challenges like that. We are constantly meeting online, in a different platform, Zoom. So to discuss about how, we are opening our university in 24th of, because our semester begins on 24th of this month. So we are starting, and then we are bringing the students into the classroom. It's a decision of the administration. They are bringing the students to the classroom, where we are trying to divide the class size to a half the size of regular, and then they are meeting alternative weeks or days. So half students comes one day, other half comes on another day. And this other half will be learning online, other half will be learning face-to-face. So it's a mess, to be frank. It's really hard on administration how to navigate in these kind of unprecedented and catastrophic events like this. And another thing we need to know is the new roles for faculty. It's an interesting topic. A faculty means your professor is a person who should be helping you to show the way. That's all. They even the word is teacher. That it shouldn't be teaching. They should only help you to see this is the way you have to go. You have to think yourself. I heard that most of you are graduate students, means postgraduate students. Here we call graduate students. So most of you are graduate students. That means the separation from undergraduate to graduate, postgraduate you call, is that you have to contribute the knowledge. You see that? Until undergraduate, you were a consumer of information. You just absorb information. When you become a graduate student, you need to think about consumer as well as you are becoming a contributor. You add to the knowledge. So you have to think yourself. That's a huge differentiation between an undergraduate student and a graduate student. So when this comes, and the faculty's role completely changes. culturally, our faculty has to look, they will step into the morality things in our country, which we don't. Here I don't have any role like that. I'm not a morality policeman. I'm here to teach and do my research and contribute knowledge. That's my role, and I have my administrative role too. So these are the things I do. In other places, what happens when we give these additional roles of morality, checking other things, the faculty is overwhelmed with the work and it's hard for them. So everyone should know this is what we are going through during COVID-19. There is no one to be blamed. That's a reality. So when we come from there to the next point, the UN report final, that's a recent one. The COVID-19 is reversing the decades of progress on poverty, healthcare, and education. It's a huge setback for the entire world. That's a huge setback. We were not thinking about this. We were not thinking, we were thinking we are going to that level of prosperity, 7 billion people in the world, everyone eventually going to that prosperity. The COVID-19 is reversing the decades of progress. In one way or other, it is affecting everyone. So then from there, I bring in 3 slides are about the United Nations report. I just briefly highlight what is happening over there. An estimated 71 million people are expected, it's an expectation, to be pushed back into extreme poverty in 2020. That's huge. That's the first rise since 1998. So, for decades, we were moving up, but it is expected 71 million people. That's a big, huge number, okay? Then comes the underemployment and unemployment. That's the 2 major, another issues. Unemployment leads to poverty, that. Underemployment, the skills are not being utilized. Let's say in our state, it happens a lot. A person with postgraduate degree has to work as a lower level skill set needed job. You see that? That is the underemployment. The skill set is not utilized. That is called underemployment. So the number is 1.6 billion. It's huge. It's close to it is the population of China, not India. We are 1.3. So that much going to affect. That's the United Nations recent report. And when it comes to the next slide, it says more than 1 billion slum dwellers. We have a huge population of slum dwellers in India is at risk from the effects of COVID-19. Why? The close proximity. If you go to Mumbai, the slum called Dharavi, in the Mohanlal's movie, I forgot the movie name. Oh my God, the super kind of super hit movie. So Narasimha, I forgot. Where he says he
Is it Vietnam colony, sir?
It's not Vietnam colony. That means he came from Mumbai. That Shaji Kailash movie.
Okay.
Yeah, it's a movie where he cleared the slum dwellers. Dharavi. That's the name he says in the movie. So think about Dharavi. I have visited Dharavi. I worked for the people there while I was doing my MSW. So I went there and I see the people are living in such a situation. I can't even imagine how they live there, because there is no boundaries for families. That's what I can say easily, because they have been separated by a cloth. There are houses with bricks and other way, but there are houses this type too. So that's a slum. So when you see that kind of slum, it's easy to understand what's going to happen in that slum. So more than 1 billion, it's going to be affected. Then the women and children are most vulnerable around the world because of the power struggles within the family too. So it is going to affect their nutrition, the diet, and it is going to hundreds of thousands of additional deaths under the age of 5. and tens of thousands additional maternal death in 2020. That's a huge, big number, which we don't, because we see the world from our close proximity, who we know, our family, those kind of things. The next slide about the United Nations report is that the school closures have kept 90% of students worldwide, that is 1.57 billion, out of school, and cost 370 million to miss out on school meals they depend on. That's a huge thing. Missing out a school meal is something, they have only the school meal they get, and they're going to miss it. That means they're not eating anything. It is huge. So think about the lack of internet, the technology, the computers. That is some other thing. The meal is some basic thing. Here you might have not heard much in the United States. Here too, a lot of kids are depending on the school meal to survive. So a lot of my students, they work in the schools, and they come and back and tell us the story about kids who are sneaking the food or to their homes so that they can eat at night, or they can give their sibling until they don't have it there. So this is something we need to know. The missing out of school meals, that is a big challenge for them. And also, when the families fall into extreme poverty, what happens? The poor, disadvantaged communities are much greater risk of child labor, child marriage, child trafficking. This is huge. When you say about child marriage and child trafficking, we think, oh, we are in a 21st century. We are not in a 21st century in that regard. These social evil are still existing in our world, and it's happening in our world a lot. So from there we move to the next slide, where what is the COVID-19 around the world. Let me see if we can share another. Well, I can only share one thing at a time. Let me stop this presentation. I will show that recent data. I will show this one. Let me see if I can pull that. Yeah. So hopefully you can see. Let me see, 1, 2, and 3. It's there. So this is the recent data from the Johns Hopkins University of Medicine, which they collect around the world, all the data. The global cases are 19,021,922. That's the data they collected. And if you can look into the mid section, the United States, obviously, it's full of red. That means US is the topmost country who has the highest infection rate in the world right now, with 4,882,270 cases. And Brazil is the second with close to 3 million, and India with close to 2 million. So that is the numbers, 3 major infected countries in the world, which you can see easily in that global map, where India is also almost red, and the parts of Europe is still red. Lots of part of Europe, Africa is it's here and there kind of a map which they show, but still it's happening. And if you look into the Latin American countries, the South American countries, it's also happening in the Brazil a lot. That's why the Brazil part is there, and the Mexico. If you look into that countries, it's also happening. So this is all over the world. The death rate is 713,813. So it's huge, and yeah. So the death rate wise, US has 160,000 death, and Brazil has 98,000 death, and Mexico, which is the third, based on the numbers of death, at 50,000 death. So this is happening around the world. So this is the latest data which which you should be. This is an authentic resource which you can check, and I could find a lot of resources, but this one is an authentic resource. John Hopkins is a very good university, and they come up with. And let me come back to my PowerPoint. Okay, yeah, I think you should, yeah, it's come. Yeah, so from there, and that's a number of COVID, and from there, I need you to think about the reality, what's happening in our place. Um, these are the few things you should be knowing, because the knowledge is power in every context. Knowledge is power. So COVID-19 is going to be here with us for some time. You have to accept it. There is no way you can deny that reality. It is going to be with us. Uh, Scientists may come up with a potential treatment for COVID-19, but it may take time. Vaccine is there to protect. Will be with us maybe they say the project is in December or January. So by maybe in November, that is the, I don't know, because all these pharmaceutical companies are saying that they are somewhere closer to that threshold of finding that vaccine, which is good. Even though they find the vaccine, it's not going to get to you on the next day. It will take time. So the projected time is between the month of Feb and in May next year. So because the initial, there is going to be a global competition to get the vaccine. That's another thing, because the rich countries will buy initially. It is going to be like that. So that is a huge challenge of discrimination and oppression when we get this vaccine. It's not an easy thing. It's going to be a global thing. But if they come to a agreement, that's well and fine. I don't want to see such a competition for vaccine, because it's going to save lives. So they should be open. It's not about the rich and the poor thing. But still, it can be expected. So we won't get that in the moment. December is least likely to reach us, the common man. They say that it should go to the healthcare providers initially, and then the vulnerable population, the elderly, and then the children. So eventually it will reach us. That's what I can say. Maybe until, so the projection is until the month of May. So you may get a vaccine. You may get before that too. So it can happen. So that's why I said it's going to be with us for some time. So we need to accept that reality. From there, you should know, I'm coming to that mental health thing too. Where should you seek information? The authentic information, the reliable information, because the science about COVID is evolving. It's a recent origin virus. It's part of the SARS virus, but still, COVID-19 is something new. It has mutation. 6 different streams of mutations is already identified, and the way it behaves with individuals is also different. One person may have a stomach ache, another person may throw up, another person has a headache. So it's not the symptom is not consistent with each individual. It's different with individuals. So it's something evolving kind of a thing. So we cannot rely on one. No, this is the ultimate. We cannot say, because next day they come up with a new information. So it's an evolving thing. So you don't believe all the information you get from the social media. Don't try to, because the WhatsApp has revolutionized, I think, in our parts of the world. It has revolutionized us information, but still what you get, you cannot depend. Always try to find various other sources. I get tons of information. I'm fed up of replying to them. This is not an authentic information. You check this source, then I send the source. And now it's really hard to keep up with all this information, because I have lots of friends and they send a lot of stuff in there, and it's really boring to comment on each and every. So I come generally after some time, most of the things you get is not authentic. Check it out. You have a phone with you, you have internet, just Google, you can find the is it reliable or not. It's just one more thing you have to do, that's all. So thing like that. And you need to rely on the scientific sources. There are a lot of scientific sources like authentic universities, or maybe the governmental organizations. So try to rely on them, but still I said it's an evolving science. So even though they say, it may change slightly the next day. So think that, and use your common sense. That is the basic thing. You have to use your common sense, period. It's not always common sense means you should be protecting yourself, you should be cautious, not be afraid. That's a thing. That's a common sense. No, is it risk, it's a risky thing I'm going to do or not? That's a basic common sense you need to look into. So when it's directly come to from the common sense to the mental health, is that the research shows COVID-19 has exacerbated the pre-existing student mental health problems. Who have pre-existing conditions of mental health, it has accelerated. It's a fact. The academic disruption, the restricted social contact, the loss of routine, the health-related fear, all these things have increased the pre-existing mental health problems of students. Another thing is in a research in China, they found that the 25% of students had anxiety symptoms and issues. So it is there. The insecurity, the confusion, the emotional isolation, and the stigma. Everything is part of the life now. So how it is affecting your psyche, that is something you have to think about. You should know this is affecting you in one way or other. That is something we need to be thinking about. See, the primary concern of COVID is stress, anxiety, and everything, but it is, collectively it's called as post-traumatic stress disorder, PTSD. This is basically most of the time, younger children and people who have mental health issues and challenges, they may experience it much more compared with other people. So you should know this kind of thing, the PTSD, any exposure, let's say I have a habit now. Even if when I go out, I need to go out to a store to buy something. The moment I step out, I try to not to touch my face. I just stepped in my vehicle, but something restrict me to not to touch. It's good. That's a good habit, but that is a stress-related behavior. I'm just stepped in. I didn't come into contact with anyone, but still I have that. But it's nowadays they say that it's a good habit because what you do is based on your habit. If you have a habit of rubbing your nose, you will do it over and over again. You should be aware in this context. You should be aware of what you're doing because it's affecting your health aspect. So again, when you think about the COVID-19 and mental health, people with pre-existing medical, psychiatric, or substance use problems are at increased risk of adverse psychosocial outcomes. That is one thing you should know. Medical, psychiatric, and substance use. In Kerala, the male population is prone to substance use, like alcohol. It's a common substance abuse issue in the state of Kerala because we have highest number. Punjab and Kerala has the highest number of substance use in alcohol-related things in India, and also we have now increased use of drug use happening now. So because initially we start with alcohol, then we want the higher dose of that kick. So we go into the higher dosage of other substances. So it's also happening in the state of Kerala. So the people who are using substances or abusing substances are at a higher risk of adverse effects on them. Another population who are affected is the healthcare providers, like the nurses, the doctors, the pharmacists, all those people, the physiotherapists, all those, they are vulnerable group, because they are the first responders to this disease, and they are coming in contact with these patients. Yeah, they've taken a lot of precautions, but still, we should appreciate their courage to deal with this situation. So we should really appreciate them on that one. Another thing is that the fear and the worry about your own health and the health of your loved ones, the financial situation, the job, the loss of support services you rely on. These things are huge. It's hugely impacting everyone. And always remember, changes in sleep or difficulty in sleeping, eating patterns, and concentrating. These are huge. Apart from everything, this is happening to you. Changes in sleep, I would say you should seek help. You should and must seek help, because sleep is one of the best things of human beings. I'm not saying about the oversleeping group. So that still is a change in sleep patterns, right? So, but deprived of sleep creates a lot of problems, than any other behaviors. That's so. Keep that in mind. Um, the first thing from we talk about this, all these say mental health issues. The first thing, there are three things you should know. One, you have to seek help. That's a primary thing. When you are experiencing a sleep deprivations or any changes in sleeping patterns, or you cannot eat, you can't concentrate, you are stressed out, that's the best thing to say. You have to seek help. You need to approach someone. Talk to your friends or someone you trust. Basically, you can talk to anyone you can trust. You can talk to your friends. Friends can understand you better. That's why I say, and also I'm not keep specifically saying your parents. Some people don't feel comfortable talking with their parents, because the dynamics of parents and the kids are different. Not kids, no, their children are different. If you don't feel like, if you feel like talking, that's the best. You have to talk to your parents. If you don't feel like, don't restrict you from talking to anyone else. Find another person who you can trust, your friends. Just talk. That relief gives you a catharsis. You ventilate your emotions out there, and you can seek the professional help. That is one of the best things you should be doing. One thing we find in our culture is that if you go to, let's say, if you're a professor, you will go and talk to your professor peripherally, just to say a kind of a catharsis, you can. But if you think you need professional help, you have to see a professional. It's like when I was teaching in India, the college, they will have this Bharatanatyam competition. So they will invite any faculty who don't have any experience in Bharatanatyam, never ever trained. They will be the judges of Bharatanatyam competition. I don't know how. I always say, why do we do that? That's not right, right? So think that every field has to be done by the professional who is trained in that field. So that is one thing you should be knowing. It's good to listen to other stories. Just a listener is good. But if you want a professional help, you have to reach the professionals. You can seek the help of a psychiatrist or psychologist or a clinical social worker. Their three groups are equipped to deal with these kind of mental health issues. Counselor, because counseling is another field. So these three people can do, mostly not the psychiatrist, but the psychologist and the Clinical social worker can do the counseling too, and the counselor, so they can help you with professional help because they are trained to do this. They will do with scientific techniques to deal with the problems you face. And comes another things, the best techniques. Um, these are the best techniques you should be looking into. You have to take a break from social media and the news. This is huge. I'm talking. If you listen to the news nowadays, the news is filled with, um, you know, the pessimist view of the world. This is happening. These many are happening. These things are happening. Everything. Most of the time, it's a bad news you are listening to. It is affecting you mentally. I was listening to a conversation in the TV news. There are a lot of discussion happening. I can't even understand what they are talking because they are overlapping each other. One person is talking, other person is jumping. It's a mess. If a person listen to the news and go back and to his house, the father will be screaming at his wife and the kids. The mother will be doing the same against, because that's a news. It's a mess. I can't tolerate that. So that is what's happening in the news. Take a break, turn it off. That's it. You will be helped by yourself. It's peaceful. You should take a break from those kind of newses and talk to your friends. Like I said in the last slide, you need to talk to your friends and think what you will be doing in the future. Think that's the hope. That's a hope. The future is always in front of you. I want to become that. I want to do this. Those kind of hopeful imaginations of future gives you spirit. It will take you away from the catastrophe. Try to laugh and smile. When you say the laugh and smile, I have to remind you of the movie again. Dulquer Salm, the DQ. That's a name you always call. ഒരു മൂവി ഉണ്ടായിരുന്നു, ജോമോന്റെ സുവിശേഷങ്ങൾ. അതാന്ന് അതെ. ആ മൂവിയിൽ he says to his he finds a girl in Tamil Nadu, and he talks to this girl that ഒന്ന് ചിരിക്കുന്നത് ഈശ്വരന്റെ പ്രസാദമാണ്, അത് കൊടുക്കാൻ ഒരു മടിയും വേണ്ട. So do that. It's in the context of a romantic context in that movie, but still that's the truth. A laugh, a smile is something you can easily add because it brings that happy chemicals in your body. It creates a happiness in your mind, and your mind is more happy. It has another dimension to it, but still you should be laughing and smiling. Then come to find happiness in where you are. The happiness is something we can find in small things. Enjoy that happiness. When you see a small kid or a flower, you should find that happiness. So basically you have to deviate from this thought. That's the basic thing. You have to deviate. You take a break from this thought. So that will help you extensively. This is something you have to know. And how to cope up with stress? It is much easy. Know what to do if you or your loved one is sick. That is knowledge. So let's say, I've got COVID-19. So what should I be doing? I should know that. I should not be panicking. This is COVID-19. The world is coming to end. No, it's not like that. So you should be aware what should be the next step I should be doing. When you are aware, you are not panicked. So be prepared. Be prepared. That's the thing. Know where and how and when to seek treatment. So you should know all these things. Where to get treatment, how to get treatment, and when to seek treatment. All these things you should answer. Because if you know, you're not panicked. You know you're in control. You're in control. Take care of your emotional health. That's the basic thing. You have to have a strong emotional health, because if you know, you are prepared. When you're prepared, you're emotionally strong. So be strong on those kind of aspects. Read success stories. That's the one good thing you should be listening to. You should be reading. um, Try to find good stories of people helping each other. There are lots of stories coming up with the media right now, recent days. People trying to help each other during this unprecedented time. They're trying to help each other. They were trying to support each other. Those are the success stories. Those success stories, again, it's also biological, a chemical that is being produced in your body. It's going to help you to be happy, emotionally strong too. And another aspect is take care of your body. Eat healthy, balanced diet, exercise regularly, sleep well. I insist that word. Avoid substance abuse, alcohol and other drugs. That's another thing. And um, uh, the last point is a critical point. Any form of suicidal thought should be addressed immediately. Like I said, recently we listened to the stories of suicide when a person is infected with COVID-19. They commit suicide. Our state is um, popularly known for the rate of suicide in the state of Kerala. So uh, please think about that. That's an important aspect. When you if you know someone who has an ideation of suicidal thoughts, these are usually we say there are 5 preventive steps. One thing we say, ask this person. Now, a person is not committing suicide all a sudden. They will come. They will talk about it. So you need to ask them what is happening, how you're going. If they share, ask what's the method you're thinking about doing. They will share that with you. I was going to use this thing or that thing. Be there with them. That's the second thing. You had to be there with them. You had to support them. That's the meaning of it. Keep them safe. You had to keep them safe in the sense that you have to take away all these things and all this. They will say, I'm going to use this thing. Don't use that thing. You had to take it away and help them connect to professionals. Professional help is to be needed, and you have to follow up with the person who is in this thing. And this is the last slide, which I'm sticking with my time. Uh, the organization, the institution should be doing what? This is basically, I will be going fast on this one. They should be provide counseling services. That's a must. The universities and the colleges and other institutions should be uh, giving this opportunity to students and other participants. Counseling services, provide student support services. It's an extensive word. So if they want academically, or if they want a technological support, and they should be seeking how we can do it. Kind of a solution should be done by student support services. Here I give, if a student is coming, they don't come to me, they go directly to the student support services. A student who is slow in learning, it's a common thing. It's okay. They learn, but they're slow in learning. They go to student support services, and the student support services professionally evaluate them, and they give me a report. This student needs, let's say, if I am giving a test for 1 hour, they give the times and I have this, so I have to give 1 hour and 30 minutes for that specific student. I give them. So because the goal is that they have to study, they have to learn. They may take half an hour more to learn. That's all. So I give them that opportunity. And another thing is to develop professional psychotherapy clinics. Like with the COVID, while I was researching, the CBT is called cognitive behavior therapy. It's one of the effective psychotherapy interventions. So a lot of it, like I said, if it's a psychologist or it's a clinical social worker or counseling services, they should know the CBT, because that's a professional therapeutic intervention that is found effective in the research which I read. So it's there, and I have kept a link here, which if you find this PowerPoint slide, And that's a good link. It's done by a school district in California here. So they gave a lot of information in that link. If you click that link, you can find it. Lots of good resources for, you have apps to do, the games to enrich you, the video, the computer games. A lot of information is an excellent resource which you can, we are in this which we never expected it to happen. We were pushed into this, right? We were living our life, and sometimes all of a sudden it happened. That brings to end. I'm ending with a story. I will say that in Malayalam. ഒരിക്കലും ഒരു രാജാവ് ഉണ്ടായിരുന്നു. ഈ രാജാവിന് ഒറ്റ മകളെ ഉണ്ടായിരുന്നുള്ളൂ. എക്കാലം രാജാക്കന്മാർക്ക് ഒറ്റ മകളെ കല്യാണം കഴിപ്പിക്കണം. അതാണല്ലോ കഥയുടെയൊക്കെ ഇതിവൃത്തം. അപ്പൊ ഈ രാജാവ് മകളെ കല്യാണം കഴിപ്പിക്കാനായിട്ട് ഇങ്ങനെ ചിന്തിച്ചുകൊണ്ടിരിക്കും. അപ്പോൾ വിചാരിച്ചു ഒരു കാര്യം ചെയ്യാം, ഒരു പരീക്ഷണം കൊടുക്കുക എല്ലാവർക്കും. ആ പരീക്ഷണം ഇതായിരുന്നു, ഒരു മുതലക്കുളം ഉണ്ട്. ഈ മുതലക്കുളം ഒരറ്റത്ത് നിന്ന് മറ്റേ അറ്റം വരെ നീന്തി ചെല്ലുന്ന ആൾക്ക് എൻ്റെ മകളെ വിവാഹം കഴിച്ചു കൊടുക്കും. കൂടാതെ രാജ്യത്തിന് പകുതിയും അധികാരം കൊടുക്കുന്നു. കേട്ട് വീരന്മാരായിട്ടുള്ള കുറെ കാലവും വീണ്ടും പറയുന്നത് പുരുഷന്മാരാണ് വീരന്മാർ കഥകളിലൊക്കെ. തെറ്റായ ഒരു ധാരണയാണ്. എന്നാലും എല്ലാവരും കൂടി, പക്ഷെ മുതലക്കുളം കണ്ടപ്പോൾ ആരും തന്നെ ചാടി ഇറങ്ങുന്നില്ല. എല്ലാവർക്കും പേടിയാണ്. എങ്ങനെ ഇറങ്ങും? ഒന്ന് രണ്ടുപേരും ഒന്ന് ട്രൈ ചെയ്ത് മുതല അതേപോലെ തന്നെ എടുത്തുകൊണ്ട് പോയി അവരെ. അങ്ങനെ അവര് മുതലയുടെ ഭക്ഷണമായി. ഒരു മനുഷ്യൻ ഇറങ്ങുന്നില്ല. രാജാവ് ആകെ ടെൻഷനായി, സ്ട്രെസ്സായി. എന്തു പറയാനാണ്? ട്രോമാറ്റിക് ഇവന്റ് ആണത്, അല്ലെ? മകളെ എങ്ങനെയെങ്കിലും കല്യാണം ചെയ്ത് കഴിച്ചു കൊടുക്കണം. ഇങ്ങനെ ചെന്നപ്പോൾ പെട്ടെന്ന് എല്ലാരും നോക്കിയപ്പോൾ ഒരാള് ഭയങ്കര സ്പീഡിൽ നീന്തുക. ഒന്നൊന്നര സ്പീഡാണ്. ഇയാള് നീന്തി ഒരറ്റത്ത് നിന്ന് മറ്ററ്റത്ത് ചാടിക്കേറി. രാജാവും സന്തോഷമായി, പരിവാരങ്ങളും സന്തോഷമായി, എല്ലാരും ഭയങ്കര ഹാപ്പി ആയിട്ട് ഓടിച്ചെന്ന് മകളെ വിളിക്കൂ എന്നൊക്കെ പറഞ്ഞു. രാജ്യം എടുക്കൂ, ഇവന് കൊടുക്കാനായിട്ടാണെന്നൊക്കെ പറഞ്ഞപ്പോൾ ഈ കേറി വന്ന ആളോ ചോദിച്ചേ, മകളുമെല്ലാം അവിടെ നിൽക്കട്ടെ, എനിക്ക് ഒരു കാര്യം ഇതിനു മുമ്പ് അറിയണം, ഏതവനാണ് എന്നെ മുന്തി ഇതിനകത്തേക്ക് ഇട്ടതെന്ന് എന്ന് പറഞ്ഞു. അപ്പൊ അതാണ് നമ്മളുടെയൊക്കെ അവസ്ഥ. ആരാണ് നമ്മൾ ഇതിലേക്ക് ഉന്തിയിട്ടെന്ന് നമുക്കും അറിയില്ല, ആർക്കും അറിയില്ല. നമ്മൾ ഒരു രാജ്യത്തെ കുറ്റപ്പെടുത്താനും പാടില്ല. കാരണം ഇത് എല്ലാവരും അതിനകത്ത് ഭാഗവാക്കുകളാണ്. ജീവിതം നമ്മൾക്ക് ഇന്നാണ് സന്തോഷിക്കാനുള്ളത്, നാളെ നമുക്കൊരു ഫ്യൂച്ചർ ഉണ്ട്. ഇതെല്ലാം കൊണ്ട് വളരെ ഹാപ്പി ആയിട്ട് നമുക്ക് പോകാം. ഞാൻ 2 മിനിറ്റ് കൂടുതലെടുത്തു. സ്റ്റിൽ താങ്ക് യു വെരി മച്ച്. നിങ്ങൾക്ക് ചോദ്യങ്ങൾ ഉണ്ടെങ്കിൽ ഇപ്പോൾ ചോദിക്കാം. ഫീൽ ഫ്രീ ടു ആസ്ക് മീ എനി ലാംഗ്വേജ്. എനിക്ക് നന്നായിട്ട് മലയാളം അറിയാം. പിന്നെ ഞാൻ ഒരു വെബിനാർ ഒരു ഇംഗ്ലീഷ് മോഡൽ ആയതുകൊണ്ട് അത് തന്നെ അങ്ങ് കീപ്പ് ചെയ്തെന്ന് മാത്രമേ ഉള്ളൂ. എങ്ങനെ വേണമെങ്കിൽ നിങ്ങൾക്ക് ചോദിക്കാം. ഹിന്ദി ചോദിക്കരുത്, തമിഴും ചോദിക്കരുത്. എനിക്കറിയാം, തിരിച്ചു പറയാറില്ല.
Dhanya, are you there?
Thank you, sir. Now that was a wonderful session. Definitely a much needed one in this current pandemic situation. Now it's time for the interactive session. The participants can pose their queries. The participants can pose their queries in the chat box.
Or you can unmute and ask. So far, no questions received.
So, sir, I myself have one question.
Okay.
Is that okay?
Yeah, sure. Yeah, feel free to.
മലയാളത്തിൽ തന്നെ ചോദിക്കാം കുട്ടികൾക്ക് വേണ്ടി. ഇപ്പോ ഓൺലൈൻ സെഷൻസ് ഓൺഗോയിങ് ആണ്. നമുക്ക് എത്രയൊക്കെ ലൈവ് സെഷൻസ് നടന്നാലും എല്ലാ കുട്ടികളെയും കാണാൻ പറ്റുന്നില്ല. കുട്ടികൾ എത്രത്തോളം സ്ട്രെസ് അനുഭവിക്കുന്നു എന്നുള്ളത് അവര് നമ്മളടുത്ത് പറഞ്ഞാലേ നമുക്ക് മനസ്സിലാവുള്ളൂ. നമുക്കൊരു പരിമിതിയുണ്ട്. അപ്പൊ ഈ ഒരു കാലഘട്ടത്തിൽ, ഈ ഒരു ടൈമിൽ എങ്ങനെ നമുക്ക് നമ്മുടെ കുട്ടികളുടെ സ്ട്രെസ് അറിയാം, അവരെങ്ങനെ ഹെൽപ്പ് ചെയ്യാം? ഹൗ ക്യാൻ വി ഹെൽപ്പ് ദം?
നല്ലൊരു ക്വസ്റ്റ്യനാണ് തീർച്ചയായിട്ടും. കാരണം ഇപ്പൊ ഏറ്റവും ചാലഞ്ചിങ് ആയിട്ടുള്ള കാര്യമാണ് ഇപ്പൊ നടന്നുകൊണ്ടിരിക്കുന്നത്. കാരണം നമുക്ക് ഒട്ടും, ഞാൻ പറഞ്ഞല്ലോ, നേരത്തെ തന്നെ പറഞ്ഞത്, ഫാക്കൽറ്റികൾക്കും അഡ്മിനിസ്ട്രേഷനും അറിയില്ല വാട്ട്സ് ഹാപ്പനിങ്. ഇത് നമ്മൾക്ക് ഒട്ടും തന്നെ മനസ്സിലാകാത്തൊരു ടെറിട്ടറിയാണ്. നമ്മൾക്ക് ചെയ്യാവുന്നത് ഇവരെ കുറെ കൂടി വർക്ക് ലോഡ് ഫാക്കൽറ്റിക്കാണ് വരുന്നത്. ഗ്രൂപ്പുകളായിട്ട് തിരിക്കലാണ് ഞങ്ങൾ ചെയ്യുന്നത് ഇവിടെ. ഒന്നാമത് ഞങ്ങൾ ഗ്രാജുവേറ്റ് പ്രോഗ്രാം ആകുമ്പോൾ നമ്പർ ഓഫ് സ്റ്റുഡൻസ് ഞങ്ങൾ കുറക്കാറുണ്ട് ഭയങ്കരമായിട്ട്. ഞാൻ 15 to 20 സ്റ്റുഡൻസ് ഒരു ക്ലാസ്സിൽ മാക്സിമം ഉൾക്കൊള്ളിക്കും, അതിന് താഴെ വെക്കാൻ നോക്കുകയുള്ളൂ. അപ്പൊ അതിൽ തന്നെ ഞങ്ങൾ മിക്കപ്പോഴും 2ആയിട്ട് തിരിക്കുക. എന്നിട്ട് 20 ഒക്കെ ഈസി ആയിട്ട് നമുക്ക് ഈ ഫോമാറ്റിൽ കാണാൻ പറ്റും. പക്ഷെ അതിൽ കൂടുതൽ അണ്ടർ ഗ്രാജുവേറ്റ് ഒക്കെ വരുമ്പോൾ നമുക്ക് അൺഇമാജിനബിൾ ആണ്. അപ്പൊ ഇതും എന്നിട്ട് ഞങ്ങൾ 2ആക്കി തിരിക്കും. അവരെ ഫേസ് ടു ഫേസ് കാണണമെന്ന് പറയും. പക്ഷെ എല്ലാം ലിമിറ്റേഷൻ, കാരണം വീടിന്റെ എൻവയറമെന്റിൽ നിന്ന് ക്ലാസ് അറ്റൻഡ് ചെയ്യുന്നതും ഒരു ക്ലാസ് റൂം എൻവയറമെന്റും തമ്മിൽ ഡേ ആൻഡ് നൈറ്റ് ഡിഫറൻസ് ആണ്. നമ്മളുടെ പിന്നെ നമ്മളൊരു ഒരു എന്താണ്, നമ്മൾക്ക് റെസ്പെക്ട് കുറച്ച് കൂടുതൽ ബിഹേവ് ചെയ്യുന്ന ആൾക്കാരാണ്. ഞാൻ അങ്ങനെ തന്നെ എടുത്തു പറയുന്നു. ഉണ്ടെന്ന് എനിക്കറിയില്ല, പക്ഷെ ബിഹേവ് ചെയ്യുന്നവരാണ് നമ്മൾ. റെസ്പെക്ട് കൊടുക്കണം, എക്സ്പെക്ട് ചെയ്യപ്പെടുന്നു, അതൊക്കെയാണ്. ഇവിടെയൊക്കെ ക്ലാസ്സിൽ ആയിരിക്കുമ്പോൾ പട്ടികയിൽ കൂടെ കാണുന്നു. അപ്പോൾ വേറൊരു എൻവയൺമെന്റ് ഇറ്റ്സ് റിയലി ഹാർഡ് ടു മാനേജ്. പക്ഷെ നമ്മൾ അതിന് കോപ്പപ്പ് ചെയ്യാതെ തരവില്ല. കുട്ടികളൊക്കെ ഉണ്ടാവും ഇടയ്ക്ക്, അവരുടെ മക്കളൊക്കെ വരും അങ്ങനെ ക്ലാസ്. കാരണം നമ്മളുടെ പോലെ ഒരു ട്രഡീഷണൽ ഏജ് അല്ല കുട്ടികളോട് വരുന്നത്. 65 വയസ്സുള്ളവരെയൊക്കെ ഞാൻ പഠിപ്പിച്ചിട്ടുണ്ട്. അപ്പോൾ അങ്ങനത്തെ ഒരു ഗ്രൂപ്പിനെയും കൂടി ചിന്തിക്കണം. അപ്പൊ അവർക്ക് അവരുടേതായ ലൈഫ് ഉണ്ട്. വീട്ടിലാകുമ്പോൾ എൻറ്റയർലി ഡിഫറെന്റ് ആണ്. പക്ഷെ ചെറിയ ഗ്രൂപ്പുകളാക്കി തിരിക്കാൻ പറ്റുമെങ്കിൽ അതാണ് ഏറ്റവും ഐഡിയൽ. അപ്പൊ നമുക്ക് കുറച്ചും കൂടി ഒരു ഇന്ററാക്ഷൻ ഉണ്ടാകാൻ പറ്റും. പക്ഷെ അത് ചാലഞ്ചിങ് ആണ്, എനിക്കറിയാൻ പറ്റും. ഭയങ്കര ബുദ്ധിമുട്ടാണ്.
പക്ഷെ ഇവിടുത്തെ കുട്ടികളുടെ ഏറ്റവും പ്രശ്നം ഇന്റർനെറ്റിന്റെ കണക്ടിവിറ്റിയാണ്.
അത് നമുക്ക് അതാണ് എന്ന് പറഞ്ഞാൽ നമ്മളുടെ ബാൻഡ് വിഡ്ത്ത് ഭയങ്കര വീക്കാണ് ഒരു പരിധി വരെ. പിന്നെ അത് ചെയ്യാൻ വേണ്ടി എന്താ പറയുന്നത്, വലിയ ഇനീഷ്യേറ്റീവ്, അത് പെട്ടെന്നൊന്നും അത്രയും വലിയ ഇൻവെസ്റ്റ്മെന്റ് ഒന്നും നടത്താൻ പറ്റുകയില്ല ആർക്കും. ബാൻഡ് വിഡ്ത്ത് ഭയങ്കര ഒരു ഇതാണ്. കാരണം ഇപ്പൊ 5G ഒക്കെ കടന്ന് കുറെ വന്ന് തുടങ്ങിയെന്ന് എനിക്ക് തോന്നുന്നു. അതൊക്കെ വന്നു കഴിഞ്ഞാൽ കുറച്ചും കൂടി നല്ല സ്ട്രോങ്ങർ ആണ്. ഫോണിലൂടെ തന്നെ സംസാരിക്കുക, അതൊക്കെ യൂസ് ചെയ്യേണ്ടി വരുമായിരിക്കും. പക്ഷെ അല്ലാതെ നമ്മൾക്ക് ഭയങ്കര ബുദ്ധിമുട്ടാണ്. കാരണം അത് ലിമിറ്റേഷൻ ആണ് നമ്മളുടെ. അത് പറയാതെ പോയി. അപ്പോൾ ഞാൻ പറയുന്നത്, ഞങ്ങൾ ചെയ്യുന്നത് എന്താണെന്ന് അറിയാമോ? ഞങ്ങൾ ക്ലാസ് റൂമുകൾ ഞങ്ങളുടെ പ്ലാറ്റ്ഫോമിൽ ഞങ്ങൾ നേരത്തെ അപ്ലോഡ് ചെയ്തിടും. അപ്പോൾ ആ വീക്കില് ഈ കുട്ടികൾക്ക് ഞാൻ എൻ്റെ ക്ലാസ് എനിക്ക് വീഡിയോ റെക്കോർഡ് ചെയ്തിടാം. അപ്പൊ അത് കയറിയിട്ട് അവർക്ക് എപ്പോൾ വേണമെങ്കിലും കാണാം. അങ്ങനെ ചെയ്യുന്നത്. ഇന്ററാക്ഷന് വേണ്ടി ഞാൻ എല്ലായ്പ്പോഴും അവരെ കാണുന്നില്ല. അത് ഇടയ്ക്ക് ഞാൻ അവർ ഇങ്ങനത്തെ ഇതിൽ വരുള്ളൂ, ഇങ്ങനത്തെ ഫേസ് ടു ഫേസ് പ്ലാറ്റ്ഫോമിൽ വരുള്ളൂ. ഭൂരിഭാഗം സമയത്ത് അവർ വരുന്നത് ഞാൻ ക്ലാസ് റൂം എല്ലാം അപ്ലോഡഡ് ആണ്. അവിടെ ചേർന്ന് എല്ലാ വീക്കിൻ്റെയും ഉണ്ട് അവിടെ. അവർക്ക് അവിടെ കയറാൻ പഠിക്കാം. എന്തൊക്കെയാണ് റിസോഴ്സ് എവിടെ നിന്നൊക്കെ ആക്സസ് ചെയ്യണമെന്ന് എഴുതിയിട്ടുണ്ടാവും, അത് നോക്കാം. അങ്ങനെ എന്നിട്ട് അവർക്ക് അസൈൻമെന്റ്സും ഉണ്ട്. എവറി വീക്ക് അസൈൻമെന്റ്സ് ഉണ്ട്. അപ്പോൾ നമുക്ക് അറ്റ് ദ എൻഡ് ഓഫ് കോഴ്സ് അവർക്കൊന്നും ചെയ്യാൻ പറ്റില്ല. അസൈൻമെന്റ്സും ടെസ്റ്റൊക്കെ എല്ലാ ആഴ്ചയിലുമാണ്. അപ്പൊ നമുക്ക് അതുകൊണ്ട് ഫൈനൽ എക്സാം എന്ന് പറയുന്ന ഒരു നാട്ടിലെ കോൺസെപ്റ്റും ഇല്ല. അങ്ങനത്തെ ഒരു കോൺസെപ്റ്റ് ഇല്ല. എല്ലാം ഇൻ ബിറ്റ്വീൻ ഇങ്ങനെ പോയിക്കൊണ്ടിരിക്കുക. അതുകൊണ്ട് കുറെ പണിയാണ്. അപ്പൊ പക്ഷെ അവർക്ക് അങ്ങനെ ഒരു ടൈം ഫ്രെയിം ഉണ്ട്. ഒരു വീക്കിനുള്ളിൽ എല്ലാം ചെയ്ത് തീർക്കുക എന്നൊക്കെ ഉള്ളൂ. കുറെ അഡാപ്റ്റ് ചെയ്യേണ്ടി വരും. ദാറ്റ്സ് എ ട്രൂത്ത്.
താങ്ക് യു സാർ. എനിക്കൊരു ഡൗട്ട് ഉള്ളത്, സ്റ്റുഡന്റ് സപ്പോർട്ട് സർവീസസിനെ പറ്റി സാർ പറഞ്ഞല്ലോ. സ്ലോ ലേണേഴ്സിനെ ഐഡന്റിഫൈ ചെയ്ത് അവർക്ക് എക്സ്ട്രാ ടൈം കൊടുക്കും എന്നുള്ളത്. അപ്പൊ ഈ സ്ലോ ലേണേഴ്സിനെ ഐഡന്റിഫൈ
അവിടെയാണ് നമ്മളുടെ ഈ പ്രൊഫഷണൽ ഹെൽപ്പ് വേണ്ടി വരുന്നത്. ഈ എന്താണ്, കുട്ടികളെ നമ്മൾ ഐഡന്റിഫൈ ചെയ്യാനായിട്ട് എഡ്യൂക്കേഷൻ ഡിപ്പാർട്ട്മെന്റിൽ തന്നെ സെപ്പറേറ്റ് വിങ്ങുകളുണ്ട്. അവരുടെ എഡ്യൂക്കേഷണൽ കൗൺസിലേഴ്സ് എന്ന് പറഞ്ഞ ഫീൽഡ് ഇവിടെയുണ്ട്. അപ്പൊ അവർക്കൊക്കെ പിന്നെ നമ്മുടെ നാട്ടിൽ ഇപ്പൊ കൗൺസിലേഴ്സിന് അത് ചെയ്യാൻ കഴിയും. ഇവരെ ഇവാലുവേറ്റ് ചെയ്യാം. പ്രൊഫഷണൽ സ്റ്റാൻഡേർഡൈസ് സ്കെയിൽ വെച്ചിട്ട് ഇവരുടെ നോളജ് ലെവൽ എങ്ങനെയാണ്, ഇവരുടെ ആ ഒരു എത്ര ടൈം എടുക്കുന്നുണ്ട് ഒരു കാര്യം സോൾവ് ചെയ്യാനായിട്ട്, ഒരു പ്രോബ്ലം കൊടുത്താൽ ഇത് വെച്ചുകൊണ്ട് അവർ ഇവാലുവേറ്റ് ചെയ്യും. എന്നിട്ടാണ് എന്നോട് പറയുന്നത്, ചിലപ്പോൾ അവർ ഡബിൾ ദ ടൈം ചോദിക്കാറുണ്ട്. അപ്പോൾ അവർ ഇവാലുവേറ്റ് ചെയ്തിട്ടാണ് നമ്മൾക്കായിട്ട്. അപ്പൊ ഒരു ഫാക്കൽറ്റിയുടെ റോൾ അല്ല ഇത്. ഞാൻ ആദ്യം തന്നെ പറഞ്ഞല്ലോ, ഒരു കുട്ടിയെ എത്രത്തോളം പഠിക്കുന്നില്ല, നമ്മളതിന് എക്സ്പേർട്ട് അല്ല. ഐ എം നോട്ട് എൻ എക്സ്പേർട്ട്. എനിക്ക് പഠിക്കുന്നില്ല എന്ന് നമുക്ക് പറയാൻ പറ്റും. കുറച്ച് പഠിക്കുന്നില്ല എന്നേ പറയാൻ പറ്റും ചിലപ്പോൾ. പക്ഷെ പഠിക്കുന്നില്ലെന്നല്ല, സ്ലോ ആണെന്നുള്ളത് പോലും നമുക്ക് മനസ്സിലാകില്ല ചിലപ്പോൾ. കാരണം എവ്രി വൺ ഈസ് ഡിഫറെന്റ്. ഇപ്പൊ ആൽബർട്ട് ഐൻസ്റ്റീൻ പറഞ്ഞത് തന്നെയാണ്, നമ്മൾ ശ്രമിക്കുന്നത്, ഓരോ അധ്യാപകരും ശ്രമിക്കുന്ന ഒറ്റ കാര്യമുള്ളൂ, പട്ടിനെയും പൂച്ചനെയും മത്സ്യത്തെയും എല്ലാത്തിനെയും നിരത്തി നിർത്തിയിട്ട് ഒറ്റ പരീക്ഷ കൊടുക്കുന്നത്. എന്താണ്? മരത്തിൽ കയറണമെന്ന്. മീൻ എന്ന് മരത്തിൽ കയറും. മീൻ എന്ന് പറയുന്നത് മരത്തിൽ കയറാൻ പറ്റാത്തൊരു വർഗ്ഗമാണ്. മരത്തിൽ കയറുന്ന ഒരു മീനുണ്ട് കേട്ടോ, അത് കൂട്ടത്തിൽ പറഞ്ഞ. എന്നാലും അപ്പൊ അങ്ങനെയാണ് നമ്മൾ കൊടുക്കുന്നത്. നമ്മളെല്ലാവരും ഒന്നാക്കി മാറ്റാൻ ശ്രമിക്കുക. സ്റ്റിൽ ദേ ആർ ഡിഫറെന്റ്. ആ ഡൈവേഴ്സിറ്റി നമ്മുടെ കുട്ടികളിലുണ്ട്. നമ്മൾക്ക് ഐഡന്റിഫൈ ചെയ്യാനുള്ള കുറച്ച് ബുദ്ധിമുട്ടുണ്ട്. കാരണം നമ്മൾ ട്രെയിൻഡ് എല്ലാവരും ഒന്നാക്കി ഒരു കുപ്പിയിൽ ഇറക്കാൻ നമ്മൾ ശ്രമിച്ചുകൊണ്ടിരിക്കുക. അപ്പൊ ആ ഒരു ഇതില് ആ പ്രൊഫഷണൽസിന് നമ്മൾ ഹെൽപ്പ് ചെയ്യാൻ കഴിയും. പക്ഷെ അത് ഞാൻ പറഞ്ഞല്ലോ, അഡ്മിനിസ്ട്രേഷന് ഭയങ്കര ഇൻവെസ്റ്റ്മെന്റ് ആണ് അതൊക്കെ. സോ ഇവിടുത്തെ യൂണിവേഴ്സിറ്റിയിൽ അതൊക്കെ അത് വലിയൊരു ഡിപ്പാർട്ട്മെന്റ് തന്നെയുണ്ട്. അവർ പറയുന്ന നമ്മൾ വേറെ ഒന്നും ചെയ്യാനില്ല. അവര് കമന്റ്, അവർ ലെറ്റർ ഇടും, ഇത് കൊടുക്കണമെന്ന് പറഞ്ഞാൽ ഐ ഹാവ് ടു ഗീവ്, എനിക്ക് വേറെ ഓപ്ഷൻ ഇല്ല. ബിക്കോസ് പ്രൊഫഷണൽസിന്റെ ഇതാണ്, ഐ ഹാവ് ടു അഡ്ഹിയർ ടു ദ പോളിസീസ്. അങ്ങനെയാണ്. അത് നല്ലൊരു മേഖലയാണ്.
ഓക്കെ സർ, ഓക്കെ, താങ്ക് യു സോ മച്ച്.
താങ്ക് യു സർ. സർ വൺ മോർ. ഇപ്പോൾ ഇത്രയും ചോദിച്ചത് സ്റ്റുഡൻസിന്റെ പോയിന്റ് ഓഫ് വ്യൂ ആയിരുന്നു. ഇപ്പൊ നമ്മളുടെ ഒപ്പം ഒരുപാട് ഫാക്കൽറ്റി ഉണ്ട്. ഈ ടൈമിൽ സ്റ്റുഡൻസ് മാത്രമല്ല സ്ട്രെസ് അനുഭവപ്പെടുന്നത്, ഫാക്കൽറ്റിയും ഒരുപാട് സ്ട്രെസ് അനുഭവപ്പെടുന്നുണ്ട്, അഡ്മിനിസ്ട്രേഷനും സ്ട്രെസ്സിലാണ്. അപ്പോ അവർക്കൊരു ഡീസ്ട്രെസ്സിങ് പോലെ എന്തെങ്കിലും എനിവേ?
തീർച്ചയായിട്ടും. ഞാൻ അതിനു മുമ്പ് ഒരു ക്വസ്റ്റ്യൻ സുജ എന്ന് പറയുന്ന കുട്ടി ഒരു പാർട്ടിസിപ്പന്റ് ചോദിച്ചു. ഐ എം നോട്ട് യൂസിംഗ് ദ കുട്ടി. സുജ എന്നൊരു പാർട്ടിസിപ്പന്റ് ചോദിച്ചു, ഹൗ ടു ഹാൻഡിൽ വിത്ത് ദ ഡൊമസ്റ്റിക് വയലൻസ് by some parents toward their wards. Or for example, one of my students' father broke a mobile phone that she has got from one charity society. How to handle these types of stress for students when they stay at home and learn? ഇതൊരു ചാലഞ്ചിങ് ആയിട്ടുള്ള ഒരു കാര്യം തന്നെയാണ്. ഈ ഡൊമസ്റ്റിക് വയലൻസ് എന്ന് പറയുന്നത് നമ്മളുടെ ലൈഫിൽ എന്താ പറയുന്നത്, നമ്മൾ ലൈഫിൽ നമ്മൾ ആരും അറിയാതെ പോകുന്നതാണ്. കാരണം we think it's part of the culture. It's not. We should be zero tolerant towards domestic abuse and violence. Zero tolerant. ഇതിനകത്ത് കാരണം നമ്മുടെ കൾച്ചറിൽ എപ്പോഴും ഒരു പുരുഷനൊരു ഭയങ്കര സ്ട്രോങ് ആയിരിക്കണം, രണ്ട് ചീത്ത പറയണം എന്ന് പറയുന്ന ഒരു കൾച്ചറിൽ നമ്മൾ we have to change that culture. That's a primary thing. We have to empower students to deal with this. അപ്പോൾ ഇത് നമ്മൾക്ക് ചെയ്യാവുന്നത്, ഇപ്പോൾ കുറെ റിസോഴ്സസ് അവൈലബിൾ ആണ്. ഇങ്ങനത്തെ ഇതൊക്കെ ഡൊമസ്റ്റിക് അബ്യൂസ് തന്നെയാണ്. ഇതിനകത്ത് പിന്നെ കുട്ടികളെ നമ്മൾ എക്വിപ്ഡ് ആക്കുക എന്ന് തന്നെ പറയുന്നത്. ഇപ്പൊ നമുക്ക് 1098 എന്നുള്ള ഒരു കുട്ടികളെ വയലൻസിനെതിരെ വിളിക്കാവുന്ന ഒരു ഫോൺ നമ്പർ ഉണ്ട് അല്ലേ, നാട്ടിലുണ്ട്. ഇത് ഞാൻ പറഞ്ഞ എൻ്റെ കുട്ടികൾക്ക് ഇത് സ്കൂളിൽ പഠിപ്പിക്കാൻ 911 എന്നാണ് ഇവിടുത്തെ നമ്പർ. വിളിച്ചിരിക്കണം. ഇവിടെ ആർക്കും വിളിക്കാവുന്ന നമ്പർ 911. എന്തെങ്കിലും ഒരു ഇഷ്യൂ ഉണ്ടെങ്കിൽ 911 വിളിച്ചാൽ പോലീസ് വന്നാൽ ഡീൽ ചെയ്യും അവർ. അപ്പോൾ ഈ ഒരു റെസ്പോൺസിബിലിറ്റി പാരന്റ്സിനും വരണം. വെറുതെ ദേഷ്യം വന്ന് വെച്ചെടുക്ക് എന്താണ് ഫുൾ ടൈം ഫോണിലിരിക്കുന്നു എന്ന് പറഞ്ഞായിരിക്കാം. ഐ ആം ജസ്റ്റ് അസ്യൂമിങ് ഇറ്റ് ഷുഡ്ന്റ് ബി ഡൂയിങ്. ഞാൻ അങ്ങനെ ചെയ്യാൻ പാടില്ലാത്ത, എന്നാലും ഞാനൊരു ഒരു അസംഷൻ പറയാം. എന്നൊരു ഫോണിലിരിക്കുന്നു. അപ്പോൾ ഇത് പാരന്റ്സിന് അറിയില്ല എങ്ങനെ ഡീൽ ചെയ്യണമെന്ന്. പാരന്റ്സിന് എഡ്യൂക്കേറ്റഡ് ആ കാര്യത്തിൽ. ഇത് ഡീൽ ചെയ്യേണ്ടത് പിന്നെ ഫോൺ സ്ഥിരമായിട്ടിരിക്കുന്നുണ്ടെങ്കിൽ വീട്ടിൽ അതിനൊരു ടൈം ടേബിൾ വെക്കുക. ഈ കുട്ടിയോട് ചോദിക്കുക എപ്പോഴൊക്കെ നിനക്ക് വേണം, എപ്പോഴൊക്കെ ആവശ്യം വരും എന്ന് ചോദിക്കുന്നൊരു രീതിയിലേക്ക് പാരന്റ്സ് നമ്മൾ എഡ്യൂക്കേറ്റ് ചെയ്യേണ്ടി വരും. അപ്പോൾ അത് ഈ ടെക്നോളജിയിലേക്ക് മാറ്റം വന്നത് ആ നോർമൽ സിറ്റുവേഷനിൽ നിന്ന് മാറിയത് പാരന്റ്സും അറിഞ്ഞിട്ടില്ല. അവർക്കും ചേഞ്ച് ചെയ്യാൻ പാടാണ്. ഇത് എഡ്യൂക്കേഷനിലൂടെ നടക്കുകയുള്ളൂ. നമുക്ക് പാരന്റ്സിനൂടെ നമ്മൾക്ക് പറഞ്ഞു കൊടുക്കേണ്ടി വരും. കുറച്ചും കൂടി ഫോൺ ഉപയോഗിക്കേണ്ടി വരും. കാരണം പഠിക്കേണ്ടത് ഇങ്ങനെയാണ്. കാരണം UN കഴിഞ്ഞ ദിവസം പറഞ്ഞതുണ്ട്, ഒരു കറ്റാസ്ട്രോഫിക് ഡിക്ലൈൻ ഇൻ എഡ്യൂക്കേഷൻ ആൻഡ് ഇന്റലിജൻസ് ലോകത്ത് വരാൻ പോവാണെന്ന് പറഞ്ഞു, ബിക്കോസ് ഓഫ് കോവിഡ്. കാരണം കുട്ടികൾ ഇത്രയും നീങ്ങിയിരിക്കുമ്പോൾ ഉണ്ടാകുന്നത് വലിയൊരു ഡിക്ലൈനിങ് ആണ് ബ്രെയിൻ ഡെവലപ്മെന്റിൽ, യങ്ങർ ജനറേഷനിൽ കൂടുതൽ. സോ വി ഹാവ് ടു ബി അബൌട്ട് ദാറ്റ്. ബീങ് ദാറ്റ് സെഡ്, ഐ തിങ്ക് ഞാൻ അതിന് ആൻസർ പറഞ്ഞെന്ന് തോന്നുന്നു. മറ്റും ക്വസ്റ്റ്യൻ അഡ്മിനിസ്ട്രേഷനിലേക്ക് വരുമ്പോൾ ഓർക്ക് ഇതൊരു ഓപ്പർച്യൂണിറ്റി ആയിട്ടാണ് അഡ്മിനിസ്ട്രേഷൻ എടുക്കേണ്ടത്. ഇതാണ് ഏറ്റവും വലിയൊരു കാര്യം. ഇതാ ഓപ്പർച്യൂണിറ്റി ആയിട്ട് എടുക്കണമെന്ന് ഞാൻ പറയൂ. കാരണം ഈ ഓൺലൈൻ കോഴ്സസുകൾ ഇപ്പൊ ലോകം മുഴുവൻ വ്യാപിച്ചിരിക്കുക. ഇത് ചെറിയൊരു കാര്യമല്ല ഞാൻ പറയുന്നത്. കാരണം US ഒരു പ്രത്യേകത എന്ത് പറഞ്ഞാലും പൈസയോട് റിലേറ്റ് ചെയ്ത് പറയും. സോ അങ്ങനെ പറഞ്ഞു കഴിഞ്ഞാൽ ദിസ് ഈസ് 2030 ഇത് $250 billion ഇൻഡസ്ട്രി ആവുന്ന പറയുന്നത് എഡ്യൂക്കേഷൻ. ഏത് ഓൺലൈൻ എഡ്യൂക്കേഷൻ ഇറ്റ്സ് എ ഹ്യൂജ് ഇൻഡസ്ട്രി. അങ്ങനെ വരുമ്പോൾ ഇന്ന് നമ്മളത് തയ്യാറായിക്കൊണ്ടിരുന്നാൽ ഈ ഇൻഡസ്ട്രിയിലേക്ക് നമ്മളുടെ കോളേജുകൾക്ക് സ്റ്റെപ്പ് ഇൻ ചെയ്യാൻ വലിയ ബുദ്ധിമുട്ടില്ല. ഇങ്ങനെ ഇമാജിൻ ചെയ്തു നോക്കും, നമ്മളുടെ സ്റ്റേറ്റ് ഗവൺമെന്റ് ഇപ്പോൾ സ്കൂൾ ക്ലാസ്സുകൾ യൂട്യൂബ് ചാനലിലൂടെ നടത്തുന്നുണ്ട്. സ്റ്റേറ്റ് ഗവൺമെന്റിന് മാസ വരുമാനം 15 ലക്ഷം രൂപയാണെന്നാണ് കേട്ടത് അതിൽ നിന്ന് മാത്രം. കാരണം എല്ലാവരും വ്യൂ ചെയ്യുന്നുണ്ട്. നമ്മൾക്കുള്ളത് റിസോഴ്സസിന്റെ ലിമിറ്റേഷൻസ് കുറച്ചുണ്ടല്ലോ. അതുകൊണ്ടാണ് ഞാൻ ഈ നമ്മൾ പറയുന്ന പോലത്തെ ഇങ്ങനത്തെ സ്റ്റുഡന്റ് സപ്പോർട്ട് സർവീസ് കൊടുക്കാൻ പറ്റാത്തത്. നമ്മളുടെ കോളേജിൽ 1000 സ്റ്റുഡൻസ് ഉണ്ടെങ്കിൽ യൂട്യൂബിന്റെ പേരിൽ 1000 സബ്സ്ക്രൈബേഴ്സും 2000 hours 4000 hours ആയിട്ട് വ്യൂവർഷിപ്പ് ഉണ്ടെങ്കിൽ പൈസ വന്നു തുടങ്ങും യൂട്യൂബിൽ. ഡു ഇറ്റ്, ദാറ്റ്സ് ദ ബെസ്റ്റ് റിസോഴ്സ്, ഇറ്റ്സ് ദേർ. അപ്പൊ നമ്മൾക്കുള്ള പൊട്ടൻഷ്യൽ ഉപയോഗിക്കലാണ് നമ്മളുടെ ഏറ്റവും വലുത്. അപ്പൊ ഇതൊരു റിസോഴ്സ് ആയിട്ട് കാണുകയും അത് ഇതൊരു ഓപ്പർച്യൂണിറ്റി ആയിട്ട് കാണുകയും ചെയ്താൽ ഇമ്മൻസ് ഓപ്പർച്യൂണിറ്റി മുന്നിൽ കിടക്കുക. ഞാൻ പറഞ്ഞല്ലോ, ഇറ്റ്സ് എ ഫീൽഡ് ഓഫ് $250 billion. ഇറ്റ്സ് എ ഹ്യൂജ് നമ്പർ. എന്തായാലും നമ്മളുടെ അംബാനിക്ക് അത്ര ആയില്ല, അങ്ങനെ ഇപ്പോൾ 70-some billion നിൽക്കുക. അതിനേക്കാൾ വലിയ ഇൻഡസ്ട്രി.
Okay, thank you, sir. Is there any more questions? Okay, there seems to be no more questions. So, thank you, sir, for your patience and willingness to answer the doubts. Now we have come to the end of the session. I now invite Dr. Sujatha NV for the vote of thanks. Sujatha, ma'am.
Okay, thank you, Dhanya. Respected Principal, Reverend Sister Dr. Gigi Jonama Xavier, Vice Principal, Reverend Sister Dr. Stella, our dear resource person, Dr. Henry Poritos, our Head of the Department of Physics, Dr. Sheena Xavier, distinguished participants, and my dear colleagues. COVID-19 pandemic is the biggest crisis in the last 100 years that has swept across the world. The entire world is trying to grapple with the disease and its terrible fallout. Our understanding of the crisis and its consequences is only in its infancy. Today, we had a very engrossing session on COVID-19 and mental health and the accompanying challenges and implications by Dr. Henry. He has proposed how we should deal with this extraordinary situation and learn to live with it. I feel privileged to propose a vote of thanks on this occasion on behalf of Department of Physics, St. Xavier's College, and on my personal behalf. First of all, I would like to thank our dear Principal, Reverend Sister Dr. Gigi Jonama Xavier, for her constant encouragement and support. Thank you, Sister, for your gracious presence today. Now, I would like to place on record our sincere gratitude to our dear resource person for this international webinar, Dr. Henry Poritos. He readily accepted our invitation and gave us a very good overview of the topic. This session has been very enriching and relevant, and I acknowledge with great gratitude that Dr. Henry is with us today from a different timeline. I understand that it is almost about midnight at his place in US. We are therefore greatly indebted to him for the effort he has put to be with us for this event. On behalf of St. Xavier's College, Department of Physics, and all the participants, I extend our sincere thanks to Dr. Henry. Thank you, sir. I wish all the very best and God's blessings in all your future endeavors. Next, I would like to thank our dear Vice Principal, Reverend Sister Dr. Stella, and our HOD, Dr. Sheena Xavier, for all the guidance, support, and motivation given to us. The success of a webinar is its participants. Department of Physics, St. Xavier's College wishes to express our sincere gratitude to all the participants of this webinar. My hearty thanks to the joint coordinator and the anchor of the webinar, Ms. Dhanya Jose. Without her effort, this webinar would not have been possible. And finally, I express my sincere thanks to all my dear colleagues whose handholding and support has made this event a grand success. Once again, thank you all. Stay safe, stay healthy. Have a nice day.
Thank you, Sujatha Miss. Thank you, participants. Now we have come to the end of the session. You can log out from the meet. I will post the feedback form again in the chat section, also for the WhatsApp, and we'll send the meet recordings along with the feedback form for everyone through their mail. Thank you.
Thank you, everyone. Thank you.
Thank you,
All the professors,
Thank you, sir.
Professor Dhanya, who invited me. Thank you very much.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you so
Bye.
much for the wonderful session.
Yeah.